you. Diolch Diprychlywydd. Thank you for your statement, Cabinet Secretary. Digital technology is transforming our health service. The use of information technology is vital to a modern NHS. We can't go back to the days of paper records or a time when test results took weeks to arrive with our Royal Mail service. I welcome the introduction of the Welsh Patient Referral System, which is speeding up the referral process and making it much more reliable. Cabinet Secretary, how do you plan to expand upon this system? And Irene Bevan Local Health Board has partnered with Doctor, which has digitised communications between patients and appointments management. The Local Health Board have said that this system has already saved them £1 million from better clinic utilisation. Do you have any plans to encourage other local health boards to adopt similar systems? I also welcome the investment in the Choose Pharmacy platform and the benefits this is delivering to patient care. Cabinet Secretary, how will you be building upon the Choose Pharmacy IT system to ensure that everyone in Wales have access to online prescription ordering, regardless of where they live? Digital technology is transforming healthcare for the better, but we have to ensure that it is properly implemented. We learnt yesterday that the majority of trusts in England who fell foul of last year's cyber attack have still not secured their systems. Can you outline the steps we are taking in Wales to prevent such attacks on our primary care IT infrastructure? Data scientists, information security specialists and software engineers are as vital to our NHS as the clinicians, pharmacists and allied health professionals who staff hospitals and GP surgeries. Can you outline how the Welsh Government plans to increase the IT workforce within the NHS? And finally, Cabinet Secretary, I would like to return to the issue of the GP IT systems. Many GP practices have undertaken significant investment in systems which integrate with MS. Can you outline what assistance the Welsh Government will be giving to those practices to ensure their systems will work with replacement systems, and how will you help to train staff on the MS replacement? Thank you once again for your statement. I look forward to the further improvements digital technology will bring to our NHS. Diolch yn fawr.
Thank you. Cabinet Secretary.
Thank you for those questions. On your final point, I think I've answered most of those points in response to Rena Yordwith, but as I say, I expect all my officials, if not me, then my official will be meeting with both the Royal College of GPs and the BMA General Practice Committee to understand the practical steps that we'll need to take in rolling out a new system, in addition to providing a fuller explanation when we're able to about the reasons for the choice that has been made following the procurement. On your point about workforce, how we develop and maintain a workforce, there's something here about exactly that. What will the workforce do? How much of our workforce will be needed to maintain our current systems and to sustain them? And how much work will we have to do to develop new products as well? And then how will we then assess the product development that takes place outside the health service? We have lots of examples of different Welsh companies that are able to develop products that could and should help the services. The challenge about how quickly we assess that. So Health Technology Wales should be able to help us to assess the efficacy of some of this. And we then need to get at a much faster pace into how we then adopt that technology and make choices across the country as well. We've invested about £10.5 million recently. In this financial year, I've approved that to accelerate some of our national systems. That should provide us with greater robustness in dealing with cyber attacks. The recent outage wasn't actually an issue about cyber attacks, but it does actually highlight the need to continue to improve our systems as well, rather than simply assuming that if it hasn't fallen over, it will all be okay. There's something there about the more general message of our healthcare system as well, not waiting for something to go wrong before we look to improve it. And again, that's part of what this statement is supposed to set out. And in terms of people's ability to order prescriptions online, that's really about Choose Pharmacy. That's really about a proper use of My Health Online or a successor product. To think about how easy it is to use for the individual citizen and also for the practice as well. We have about 220,000 people sign up to use My Health Online, but actually in a country of 3.1 million, that's not enough. it's not a great enough portion that are able to use it and access it, and equally then to make sure that our general practices are able then and willing to properly use the whole system. And there's also, for example, the great use of text and other things, or simple things which should actually improve people's awareness of what's going on, actually just making sure we don't lose time in the way that our appointments and infrastructure works as well. There's great waste and inefficiency in that, and actually digital technology should help to be part of the answer to try and reduce that. And that should mean a better use of the healthcare professionals' time. We talked previously about the use of telemedicine and telecare, and it's an issue both for hospital-based care but also in local healthcare as well. Not just the comments that Lee Waters has made, but think about the opportunity to provide advice, guidance, care and treatment with a healthcare professional, as well as to make sure we move information around our system to make sure it's getting to the right healthcare professional to help make a choice to have an informed conversation with the individual as a citizen. And I think this goes back to Angela Burns' points at the start as well about safe sharing of data and the effective use of data. And the encouragement is that we have actually set ourselves on a path where we're looking to make that easier to do, to make it easier to share that data across our health and care system. And the other encouragement in that is I think we've turned a corner. A few years ago, well, certainly when I first became an Assembly member, there was much greater reticence between health and care professional groups about sharing of data and information. I think we're in a different place now. Not only that, but the public are ahead of where we are and ahead of where I think professionals are. They want and they expect us to be able to share that information to help them to make choices, to make sure they don't have to repeat information to more than one person, and because they want us to be more joined up. That's where they want us to be. So it isn't just an enabler, it's essential to delivering the vision for the future. Some of it happens now, and we should celebrate and recognise that. The challenge, as ever, is how much more we could and should do to deliver better care, better outcomes, and actually better value for all of us through our health and care system.
Thank you very much, Cabinet Secretary. And that brings today's proceedings.